Talk about Medicaid reform and give a basic overview of what it's about. I apologize for sitting down. Is to make Medicaid work more like the private market, even more so, even though Medicaid is often managed in most places by managed care organizations. This was a push to make it even more like private insurance. And so the state had to apply to the Center for Medicaid and Medicare Services for a federal waiver to do this. This is it's a very unique program in that it has not been implemented anywhere else. We're trying to do it in Louisiana now. But in theory, the input, so you would have increased competition between managed care organizations, everything that they were, the amount of money that they were being paid, the benefits and services that they were providing to the beneficiaries would be more transparent than traditional Medicaid. Everything would be data-driven. And that the beneficiaries themselves, or the consumers, would get to choose between several different plans. And that within this increased market and increased competition, that the plans would compete for beneficiaries, and so they would provide better services in the long run. And so what you would have is a menu of different plans, more than before, with different services, with additional services that were not offered before through regular Medicaid, that they could add additional things such as adult vision and dental and things that you might not have seen before. You would have better health outcomes. And in the end, Florida would save money, which was really the big push, because back in 2005, they were still saying how much money is being eaten up by the state budget through Medicaid. They often didn't talk about the federal dollars that were being drawn down, but it was really put into crisis mode. And if we don't stop Medicaid spending, it's going to eat up the entire budget. We've got to do something now. And in today, that's really the impetus behind Medicaid reform. There's a lot of talk about competition and the market, and consumers can have all these wonderful choices. But in the end, it's about money, which I think we all know a lot of things are. So those are the theories behind Medicaid reform. So what's happened? There's been a lot of confusion, administrative burden. It's not been a smooth implementation of Medicaid reform. It's in a pilot mode right now in 5 counties. There's been a lot of administrative problems. ACA is in charge of implementation. Provider access, although it was touted as being the impetus for this was to increase access to providers, we've actually seen that with the number of plans entering into this, that all the providers are divided into these different networks, and so now people they can only choose from maybe from a limited list of providers from their one network that they've been placed into or selected. Same thing with specialists. People are being denied services. There's longer delays. The preferred drug list is a huge problem. Nobody knows what drugs are on the PDLs, and so they have to go through this whole process. That was a problem with Medicaid in itself, but it's just become even more difficult. And then people, once they get into a plan, they don't know how to get out of it. They don't know how to switch to another one. So where's Medicaid reform? So the waiver to the federal government, so the state had to apply to the feds to do this, was based on statewide expansion. So the intent is that this would eventually go statewide. The legislature approved a pilot program in initially Broward and Duval in I think the summer of 2006 that expanded to the rural counties around Duval, Baker, Clay, and Nassau. So you have approximately 197,000 participants, I think, in those counties right now. So these are our guinea pigs in these counties, and we'll talk a little bit more about expansion, but basically this has to go back to the legislature before it can be expanded to other counties.
A question in the back.
Yes. I'm talking about right now specifically, so any Medicaid beneficiary in these counties must enroll in a managed care organization. It's not voluntary. So that if they do not pick a plan, they're going to be auto-assigned. So don't we already have Medicaid HMOs in Florida? Like what is the difference that we're talking about? This is the big confusion. It's taken me a while. Here's the difference. So Medicaid reform in itself is what the federal government has given the state of Florida permission to do, which is basically that HMOs can now determine the duration and scope of services and benefits, which is a huge difference in that they still have to provide the same types of Medicaid services, but they now have the freedom. So they can say you can have X amount of home health visits or X amount of physical therapy. And there's different things that you can do within the system to say, well, this person actually needs more home health visits because people are going to run out of that real fast in certain situations, especially when you're talking about chronically ill or disabled or elderly people. But basically, the premises behind this was that some HMOs could actually say, well, this is great because we're going to provide X amount of emergency room visits, or I don't know, X amount of this, and on top of that, we're going to give you this extra benefit, and that we're going to provide more transportation or pay for nutrition classes or exercise classes, and then that would make up for them limiting the duration and scope. But there are approximately, as I mentioned, I think 197 Medicaid beneficiaries in the pilot counties now, and that's without expansion. Of those 197,000, 2,700, and these are all approximate numbers, are dual eligible for Medicare and Medicaid. Now, one of the stipulations of Medicaid reform was that a dual eligible was not mandatory for certain populations to be enrolled in a managed care. And one of these populations was the dual eligibles. So most seniors actually don't have to be, they are not required to be in Medicaid reform, in theory. But what's happened is, according to data that we're seeing, the process is confusing. They don't know that it's voluntary, and for some reason, we've got 2,000 seniors in Broward County alone enrolled in Medicaid reform. And then we have this senior care pilot legislation, which is very familiar, very similar to Medicaid reform, in that it's Medicaid. There was a legislation passed, and I'm sorry, I don't know the year. I think it was around the same time. It might have been 06.
It was 06.
06. Okay, so the senior care pilot program was legislation that intended to bring Medicaid reform to Central Florida and also, I think, the Miami region.
I'm not sure.
So I think, but this was going to be voluntary, and so anyone on Medicaid over the age of 60 was going to be placed into this managed Medicaid reform. They were going to have to pick an HMO or a provider service network, and they were also going to have these expanded choices, but these HMOs would also have the freedom to limit the scope of their services and the level that they would be getting. What happened was, and this was supposed to start in a month, ACA delayed this a couple of months ago indefinitely. They said they weren't ready, they're not going to do it. There's a lot of, people are kind of guessing on why that is. Some have said that in Central Florida there's just not enough nursing homes, there's just not enough providers for them to do this, and ACA's not ready. The big thing is that it's not mandatory, and so a lot of HMOs don't want to participate, because if the seniors aren't required to pick a plan, they think that it's not going to be profitable to them unless they can, because they're not going to have enough people in their program. You have the Office of the Inspector General with ACA. They've done some reports. A lot of people are looking at this nationally, and I think before kind of the change in power nationally in the White House, a lot of people were actually, because this not only came from the Jeb Bush administration, but this really came from the George Bush administration as well, as a way to save money in an entitlement program. And so a lot of states have been looking at this like, wow, is it going to be duplicated? Are they trying to do away with regular old fee-for-service Medicaid? What's going to happen? So that's why Georgetown University has gotten involved. They've done several policy briefs on different facets of the program. University of Florida is being paid by the state to evaluate it, PAGA, and then health advocates like my organization. I'm sure you're all very familiar with Florida Legal Services. They've been very active in this, particularly in the pilot counties, in Broward and Duval, and helping just individuals. And in your packets, I'm not going to talk about the stories, but in your book, if you get a chance, there's probably 2 or 3 pages of consumer stories about how bad this is. And I think people kind of get a better picture when you do talk about how this is really affecting people. And Florida Legal Services has just been wonderful in helping some of these individuals. There was a young woman, college age, who called us. And when you call my organization, and you've been everywhere, we're the last people somebody finds. because she had a tumor, she had throat cancer, and it was growing, and nobody would claim her. A lot of problems is that you get auto-assigned into a plan, but then nobody will claim you. No doctors are in that plan. And her tumor was growing, and she emailed me a picture, she's 21, of her throat cancer that had grown, just of her like happy on vacation, and then another picture of this lump in her throat. And she had emailed me, you know, I was just like, wow, this is how the delay in services is so unfair. And there's a ton of cases. I mean, there's women, pregnant women are actually supposed to be one of the populations that are excluded from this, but some pregnant women have been auto-assigned into a plan and been told that they, can't get care from this doctor and that doctor, and they're having miscarriages. I mean, it's really horrible stories. So that's another part of what we do, is trying to help individuals in filing complaints with the state and with ACA, because they often